Hi, good afternoon, everybody. I think we got a nice mock for the topic. As Damien said, last year we had a patient here who came down from London. It was very nice of him. It costs a lot to get patient here, and he has a childcare issue, so he can't come. So he has sent his short video, which I'm going to play at the end of the presentation. So mindfulness. Uh, First of all, no declarations, no financial or religious benefits associations with this technique. I'm going to do a PPT for 12-13 minutes, and then what I really want to do today is to play audio instruction for 10 minutes of actual mindfulness technique, and I want all of you to experience. It's not compulsion, but it's nothing religious, nothing ritual about it. It's straightforward scientific technique. A case report will run for 7 to 7.5 minutes, and then I'll take questions. So, background, the basic reason for this topic and all this fuss about mindfulness and being equanimous and balanced is about stress. We all are in stress, and there is a scientific proof for that. There was a landmark survey done in whole of the Australian subcontinent, which showed that doctors and medical students were in a lot of stress in comparison to the general population of Australia, as well as other professionals in Australia, and they were more psychologically distressed and they had more suicidal tendencies in medical field. A few years later, BMJ produced a national survey of 600 senior consultant level professionals, and they produced the same results, that a lot of consultants were thinking of premature retirements, and the main reason for it was work-related stress. We did survey, as few of you might remember, in North Wales. I did it with Dr. Mark Knights in end of 2016, early 17, for junior doctors and every doctor, in fact. And we had a similar sort of results for stress in doctors, comparable to national statistics. So mindfulness, to what level it has penetrated into medicine and medical practice? Well, there are lots of RCTs and systematic reviews and loads of projects going on at the moment, and it's been in place for last 3 to 4 decades. It's been incorporated in various, not just psychiatric and psychological illnesses, but non-psychological somatic illnesses as well. And every study has shown that it has at least some positive endpoint on both psychological and physical aspects. So it has shown positive results in depression. NICE in fact recommends mindfulness techniques in certain depressive illnesses, addiction, de-addiction programs. Not just those, but conditions like psoriasis and chronic pain. I've got one video of a patient which he shows the benefits of mindfulness in his sciatica. So there are lots of areas where mindfulness is very important. Areas like geriatric medicine, palliative care, where people can be more mindful about their illnesses and they can stay calm and stress-free about dealing the end of life stuff, so they can die mindfully. It's an area of interest nowadays. The big corporate institutes like Google have been doing mindfulness in their staff members. They practice mindfulness meditation during working hours, and it's shown very good results. So what is mindfulness? It is moment to moment watchfulness about oneself, plus there is openness towards that experience. Whatever is being observed, being experienced, we have to be open about it and accept it as it is. Why do we bother about being mindful? Why not escape from the real situation? So our minds wander about 47% of the time, and wandering of the mind is associated with unhappiness. whereas the capacity to be mindful is associated with higher well-being in daily life. That's a 2003 study, but we know it since last 2600 years. People have been practicing mindfulness in Eastern countries, and they have proven this. They have written in the literature about this higher well-being states.
How did they find out 47% of the time it wanted?
It's the subjects, they were asked to perform the task, and they were asked to report when they were not actually concentrating, they were not mindful about things. But I don't agree with this study.
But what was there some sort of default that they should be concentrating on certain things?
They should be concentrating on their own experiences.
Is there any difference between male and female in terms of mind wandering?
That's a good question.
Very good question.
And what it
Yeah.
wanders on.
According to the ancient text, there's no difference between male, female, races, creeds, no
But how
differences.
you can do such a study? I mean, each
Yeah.
person is different. I mean, I might be fighting with my wife and come to do the job. The other one is have 2 pints of alcohol and come to do the job.
Yeah.
The other one has some financial difficulty coming. How you can put these biases? How you can do study?
Yeah, well, these are the studies in normal volunteers, who have participated in the studies, and they have reported that in such and such interval, this many times my mind wandered. But to be honest, I don't agree with 47% figure, because this is only a daytime survey. Daytime, what happens during night, nobody knows. Our mind is wandering all over. We're having dreams, nightmares, and we're responding to cold. In countries like my country, we're responding to the mosquitoes, and nobody knows what happened during night. So mind is always wandering here and there. So I don't agree with 47%. I think that should be 90% or 95%. Our mind is not in control. So whichever meditation which is being practiced or taught anywhere in the world has to come under one of these categories, either a pure form of one or maybe a mix of 2 or 3. Contemplative meditation, where a meditator repeatedly memorizes certain inspirational passages from spiritual books or scripts, like prayers, passages from Bible, Quran, or Gita, or maybe from Buddhist text. So they repeatedly do that. The mind gets concentrated on this memorizing process, and they find it peaceful. So works good for people. Absorption meditation is slightly different, where the meditator concentrates on one object of meditation. So object could be auditory, visual, tactile, or it could be a mental object where meditator just observe the thoughts. Whatever thoughts are coming, they observe. The mind gets absorbed into this object of absorption, and the meditator finds it peaceful. The third type is insight meditation. It's different from above two. The original progenitor of this technique, the Buddha, is described insight meditation in great details. And his discourses about it, they are originally in Pali language, which was the language of India in those days, 2600 years back. And they form 3 groups of books called as Tripitaka. He gives a clear path, and insight meditation emphasizes on experiencing the true human existence rather than concentrating on outside object of like verbalizing, visualizing, or chanting, praying. It actually wants us to go in and experience your own experiences. Various different mindfulness techniques have been practiced all over the world. Since these mindfulness teachings were offered outside the monasteries about 4 to 5 decades back, prior to that they were only taught in monasteries and nobody knew what these teachings were. But then people like John Kabat-Zinn, and there's one chap in UK is called Sangharakshita. I don't know whether anybody has heard. These guys brought these techniques to the Western countries, and a lot of research happened, and this is one of the most extensively described technique, mindfulness based stress reduction. A lot of research has been done in US. It is taught on an outpatient basis, on a weekly basis, but you do get residential retreats, and nowadays there are internet based apps and websites teaching mindfulness techniques. So this is what is happening in the West. But let's talk about what is been described in ancient books. The original word for this technique is Vipassana, which is nothing but the Pali word for mindfulness with equanimity. Equanimity is balanced and objective observation of the reality of oneself. The Vipassana is taught in 3 stages. There are 10-day residential retreats. They're taught in specific centers. It's free of cost. Free teaching, free lodging, free food, everything free for 10 days. And people go and do this. The first stage is to control wandering mind and make it mindful. And that technique described is known as Anapanasati, which means An is incoming breath, Apan is outgoing breath, and Sati is awareness. So awareness of the breath at the entrance of the nostrils and the adjacent area of upper limb, the natural breath. This is not the exercise of holding breath or taking deep breath. This is just an observation of the natural incoming and outgoing breath technique, which has been described in the literature 2600 years back and has been transferred to us by generations of these monks who kept teaching to their next generation, and is now passed on to us, and it's available to us now. When I started doing this in 2000, I realized what wandering mind meant and what monkey mind meant. The mind goes everywhere, and that then you can't believe 47% times it wanders. And you have to believe it wanders 90% times. So this is the first stage taught on Vipassana process.
If they stop the mind wandering, everybody sits and controls the mind. I doubt any research would happen nothing would have progressed in the world. If you put a different spin to it.
Yeah.
All the research, most of the research has happened because mind kept wandering.
Yeah. Yeah.
If everybody controls the mind,
yeah, but
won't we all be in the same
yeah.
storage or ice age or whatever?
Wandering in different sense. The mind concentrating on certain things like treating patient or doing a research with peace at mind is different. And with
where do you differentiate?
yeah, you can see the atom has been described in these books. It describes subatomic particles. The Pali literature describes about electrons and protons and their vibration frequencies. It's been described, and the frequencies match with what Rutherford has told us in last century about atoms, subatomic particles. But look at what the end product is. Rutherford devised a nuclear bomb after his research, and what Buddha did, he gave a way to the population to how to get a peace, how to get a happiness. So the mind without peace, there's no happiness. You don't enjoy it. You can devise weapons.
I take your point, but I don't think we would have progress if the mind is not wandering.
Yeah.
You understand what I mean? If you don't
I get your point. Yeah.
If you don't build upon your concepts,
yeah.
then I don't think any progression will all be still sitting in a bodhi.
Yeah, you're talking about thinking. Yeah, thinking in one direction or on various things is different from wandering mind. Like if I'm studying now and if I'm not able to concentrate on thinking of 10 things, then that's a different thing. But if I'm studying and thinking about that, it's a different thing. Because we are not used to a peaceful, concentrated, balanced, equanimous mind and still study hard, work hard and have that peace. We're not used to that. So it's difficult to accept the situation where how can you say concentrated, controlled mind, and you can still be doing research and you will still be inventing different things. You will still do everything what you are doing, but with the peaceful mind. You will still treat the patients, but with good relation with the colleagues, with the good, less stress, less health hazards to yourself. This has been proven in the research. Like in chronic pain patients, if you just make them mindful of their pain, they start dealing with their pain in a better way. The pain is still there. Mindfulness doesn't take away pain, but they start working more, they start become more active, they join back to their work, their family life improves because they are mindful. They start accepting the things as they are. So being mindful doesn't mean you are like, inactive ball of mass and you are not doing anything. Being mindful is you're still active but you are at peace. You're still teaching, like if some junior is troublesome, so you're still training, supervising junior, but with love in your heart, not hatred. Like looking at the junior, you will feel, oh, again he's same chap. Not with that, you will have love, compassion for that. The best example of mindfulness, whenever I'm asked this question, I say the best example of mindfulness is when Christ died. He knew he was going to die. Those guys were going to kill him. But see what he had in his mind. He said, let me not suffer for what they are doing. They are ignorant. They don't know what they are doing. They are committing bad things. So he was so mindful. He at the time of death, he was at peace. So imagine if there is something after that, what stage you would have achieved. So in day-to-day life, it definitely helps to be a calm, peaceful, mindful person and still do the same job. It's more effective and it's more enjoyable. That's what my experience is. I don't. Just a quick run through Vipassana technique now. So this is the second stage of what is taught on Vipassana courses. This is what has been described in the ancient text. Any stimulus, whether it be external or internal body or mental, physical or mental stimulus, is recognized by sense organs and like eye, tongue, nose, skin. The brain perceives it and gives the judgment about perception, whether it's good or bad. Like words of praise are taken as good, criticism or threat or threat to life is taken as a bad stimulus. Correspondingly, as the brain is perceiving and making judgment, there are sensations produced in the body, and whatever brain perceives is that appears in the form of sensations. If the brain perceives it as a good sensation, good stimulus, we feel pleasant sensations. If somebody praises me, Sangram, oh, you're a nice lecturer, nice presenter, then I get a good pleasant vibrations, wave of good vibrations in my body. Whereas if somebody criticizes, oh, I didn't like your something, then I get a warm, tingling, pricking kind of unpleasant sensations. Like when we are angry, we become hot, and there is a prickling everywhere. Then there's a part of mind which reacts to these sensations. So if they are pleasant sensations, mind wants them more and more. Simple example is if somebody consumes alcohol or cigarette or morphine with the previous experience in the background, the brain will say, oh, that's nice, I like that. So mind will want it more, and that's how one falls into that habit of wanting more. Or say for example pain, the brain perceives it as a bad and the sensations produced are not good, so the mind doesn't want it. Mind falls into habit of aversion. So this habit of reacting to stimuli is the cause of stress or misery, according to Buddha. This is a bit complicated diagram, but I'll just finish it in a couple of minutes. So the body sensations, either pain or pleasant sensations, we saw in the last slide, if we react to them, we produce habit pattern. And these all habit patterns are deep down inside our mind. We can call them as defilements, old stock of defilements. If one starts practicing Vipassana, he observes the sensation but doesn't react to them. This is the technique taught on the courses, how not to react to the sensations while doing your body scan from head to toe and from toe to head. And we don't produce that extra defilement, and that's how reacting to the situation with non-stressful way is taught during these courses. That's how Vipassana works. Now let's have a look at the case report.
Hello and welcome. My name is Felix, and I've been asked by my friend Sangram to talk to you a little bit about my experiences with pain and Vipassana, a meditation technique that has helped me a great deal over the years. So the background to my story is that in about 2012, I injured my knee quite severely, and a meniscal tear on my right knee, and it was very serious, very painful, and in the whole process of recovery I limped quite extensively for quite a few weeks, and put all the weight onto my left leg in order to protect the right knee. And for one reason or another, my back went, I started to develop sciatica, very serious sciatica, which was seriously painful, and I didn't really know how to get out of it. I was struggling a great deal, and I was unable to drive properly or I just wasn't free from pain. I barely slept at night. I would wake up at 3 in the morning every night, and life was pretty intolerable. So this went on for a few years, and I got to about 2014, I think, and I was in quite a bad way, and I went to the doctor, the GP, and I said, look, I can't cope. What are the options? And they offered me tramadol and diclofenac. So I used to take those in combination, tramadol in the evening, diclofenac as a suppository in the day. And I got some relief in the sense that I think the diclofenac would take the edge off things, and the tramadol didn't actually take the pain away, but it would just numb me out really, or sort of, not anesthetize me, but, make me sort of slightly unconscious, slightly less in touch with the pain. But it didn't actually resolve anything, and I was still struggling, on a daily basis. And then I decided to have some scans done. Obviously, they had a look at the disc. There was a compressed disc, the base of my spine. I had some injections, some steroid injections, in order to help possibly alleviate some of the pain. That didn't really work. They were pretty ineffective. And I was stuck really. I was in a bit of a rut, and this was going on now up until 2015. And I decided that I wanted to go and do a 10-day Vipassana meditation course. I hadn't done one for 5 years. I think the last one I'd done was 2009, I think, September 2009. So I'd had a child in that time, and I was running a business, and I just didn't have the time to take off work to go away for 10 days. But things got so bad for me that the pain was so severe that I just said, no, I'm taking the time out. I didn't feel like I had any alternative. So off I went, and it was a very intense experience. And what I found with the meditation was that rather than looking for a sort of solution outside of myself, rather than looking for a drug or an osteopath or a chiropractor or something to fix what was going on, I learnt to stay completely present with what was going on in my body, and that meant actually going into the pain, observing it in a way which I hadn't really done before, which was being completely neutral. And I learnt to accept it as it was, and the more I learnt to accept the pain and not try to fix it, not trying to change it, and not try to run away from it, the more it sort of dissipated, and I became less scared of it, and I became less fearful of it, and it kind of just, it almost evaporated over those 10 days. It was quite an incredible experience. And yeah, after that, I've never been scared of it. Even now to this day, if it does flare up slightly, and it does occasionally, my sciatica occasionally kind of peaks and comes back. I don't react with fear. I don't react with panic. I don't get a sense of, oh my God, oh no, calamity, I'm in trouble, or I don't get depressed. I just spend time with it. I just engage with it in a completely different way. And it dissipates, it goes away. You know, I do have some exercises that I do. I do find that stretching my hamstrings helps. But I've never taken any medication since that course. I've never taken any more tramadol, any more diclofenac since you know, I think it was February 2015 I did that course, a meditation course. So, you know, we're 2018 now, and
Okay, I think that's a bit more relevant to our talk. So that was the case report. He described what he got from Vipassana course and how it helped him to deal with his chronic pain condition with a lot of psychological elements to that. Questions, please.
Thank you.
Thank you.